Okay, now we are going to be covering the lymphatic system. Obviously, if this is a system, then it is composed of organs, and in this case, the organs are composed of tissues. And you're going to see that the reason why I'm saying that is because there are some tissues in this particular system that are going to be important. So right here, you have a general disposition of the different organs that you have in the lymphatic system. You will see in this figure that, again, not only you have organs, but you have also tissues that are going to be important. So right here, you have lymphatic vessels in green, bone marrow, spleen, lymph nodes right here, quite a few as you can see, as well as the thymus. Those are the main organs that you're going to have in the lymphatic system. Some tissues, a group of cells basically associated with some epithelial tissue covering them, such as the tonsils, but you're going to see that there are some other ones later on when we continue with this chapter. So in this system, you have to be aware that you need to talk about organs as well as tissues. So let's keep scrolling down. Let's talk about now the functions of the lymphatic system. There are three main functions: fluid recovery, immunity, and lipid absorption. Fluid recovery, as you know, when we are talking about the capillaries, for example, we're saying that most of the fluid as well as the nutrients are going to be absorbed at the level of the capillaries. I said most of them because approximately 80 to 80% is reabsorbed by the capillaries. However, the 15% to 20% that remains in the tissues is reabsorbed by the lymphatic system. That's why one of the jobs of the lymphatic system is to reabsorb fluid. What happens when you don't reabsorb the fluid properly for whatever reason, disease and particular medical condition, then obviously this is what's going to happen. This is normal. This one right here is obviously abnormal. In this case, probably it's caused by an infection, but you can see in there that if you don't reabsorb the fluid, then you're going to start accumulating this fluid in your body. Okay, and obviously that's called edema. Immunity, because your lymphatic system is going to recover the fluid, and in this fluid many times you're going to find bacteria, viruses, in other words, microorganisms that may cause infection, and the lymphatic system obviously is going to be an important part of immunity because it's going to help you fight these foreign substances or microorganisms that may cause disease on you. We will talk about it later on when we cover immunity in the next few pages. Lipid absorption, as you know, we are going to absorb nutrients at the level of our intestines. You absorb proteins, you absorb carbohydrates, you absorb lipids, and there's no problem with them. But as you know, there's a famous saying that says water and oil don't mix. So fat is oil basically, and your blood has a lot of water. So then it's not really easy then when you absorb the fat to be placed directly into your blood because your blood has a lot of water, and we are saying water and oil don't mix. So therefore, since they don't mix, that will cause a problem, for example, because the fat may be stuck in your fingers, right, in the little capillaries that you have in your fingers, therefore causing problems. So for that reason, you don't absorb the fat directly into your bloodstream, rather it is reabsorbed through the lymphatic system. That's why another job of the lymphatic system is lipid absorption. The lymphatic vessels that you're going to use in your intestines to reabsorb the fat are going to be called lacteals. Very important then, we need to summarize the functions of the lymphatic system. Right here we said fluid recovery, part of the immunity, and lipid absorption. Okay, and again, lymphatic system, we already talked about it. They are going to be the organs, the systems, the lymph, and the lymphatic vessels as well. So let's take a look at lymph. Lymph is basically the substance, the fluid that goes through your lymphatic vessels. The same way the blood goes through the blood vessels, well, in this case, lymph goes through the lymphatic vessels. Lymph is basically what is going to be collected by the functions in your lymphatic system. So you collect fluid, you collect cells, part of immunity, and you collect fat basically, right? Because fluid absorption is again a function. So they're basically lymph is going to have more or less the same characteristic that plasma has, but it has less proteins. So, but it's what flows through the lymphatic vessels. The lymphatic vessels are going to be very important because these ones are the ones that are going to help you collect the fluid that eventually needs to be recycled. Otherwise, we're going to end up with edema. Okay, so you have that the smallest lymphatic vessels are going to be obviously lymphatic capillaries, and you are going to find lymphatic capillaries mainly your whole entire body, except in some areas that are very specific, such as, for example, right here it says your nervous system, cornea, bone, as well as cartilage. Okay, so it's very important, guys, to remember that part. So one characteristic that lymphatic vessels have is that they resemble the veins. One characteristic that the veins and the lymphatic vessels are going to have is, again, that veins have valves and lymphatic vessels have valves as well. So right here you see the capillaries, right? Blood vessel capillaries right here, and you can see in here the capillaries in this case that belong to the lymphatic vessels. Okay, very important, because the excess fluid that is going to remain in here that is not going to be reabsorbed by these capillaries is going to be reabsorbed by the lymphatic vessels, in this case the lymphatic capillaries. Okay, so if we keep scrolling down right here, you can see the lymphatic vessels again allowing this different fluid to be reabsorbed through it. Okay, let's keep going, and right here we see that right here that you have valves in the lymphatic vessels. Okay, very important. The flow of the lymphatic vessel, basically, it follows the same way the veins are going to return the blood to your heart, right? You're going to have the skeletal pump, the respiratory pump, right? That is, again, every single time we contract the muscles in our legs, for example, that's going to help you push the blood. Well, in this case, the contraction of the muscles is going to help you push the lymph to your back, into your towards your heart, I should say, towards your heart, not into the heart, but towards the heart. The same way happens with the abdominal mechanism, right? The thorax produces decreases the pressure, therefore the pressure in the abdomen increases, and that also pushes the lymph to move upwards. Very important, obviously, since it follows more or less the same pattern that the veins are going to have, then obviously the valves in the lymphatic system, in the lymphatic vessels, are also going to help this backflow, this return of this lymph back towards the heart. One thing that you need to remember is that the lymphatic vessels don't have the help that the heart provides to the blood flow. Okay, so there's not that pressure provided by the heart. So there's no such thing in the case of the lymphatic vessels. So right here in this figure, you can clearly see the valves, for example. The lymphatic vessels also follow more or less the same number of layers that blood vessels have, in particular the veins again. We said that they have 3 layers, so then the lymphatic vessels also are going to have 3 layers. You can see in there, for example, tunica media, tunica interna, and tunica externa right here. Okay, so it has 3 layers. So if you scroll down right here, you can clearly see the valves. They are clearly displayed in this figure. Okay, and again, that's going to help the blood go back towards the heart. Remember, again, it doesn't go into the heart, but rather it is pushed towards the heart. Okay, so then we reabsorb the fluid, the excess fluid, using the lymphatic capillaries. The lymphatic capillaries are going to follow a sequence of blood vessels similar to the blood vessels that we have, large, medium, and small. Same thing in here, the lymphatic capillaries then connect to collecting vessels, lymphatic trunks, and from there the collecting ducts. The collecting duct is part of the lymphatic vessels, and then they're going to drain this fluid that is absorbed from your tissues into the subclavian vein. So the connection is, again, is not that the lymphatic vessels are going to send the fluid into your heart, but rather they're going to dump all that fluid into the subclavian vein. Then the subclavian vein obviously is with the area where all this lymph is going to get mixed with the blood, and then is going to return into your heart as part of the blood that is going to return to your heart through the superior vena cava. As you can see here, the lymphatic vessels collect the fluid, and you can see the arrows, how it's showing you that the arrows goes up. Here's the lymphatic vessels from the upper part of your body sending information down. And you can see here how they dump the lymph into the subclavian vein. And from the subclavian vein into the superior vena cava, and the superior vena cava is going to obviously return the blood into your heart. Then your heart is going to pump obviously all that fluid already mixed with your blood, that it has no difference now, it's just blood, into your body. One very important thing that you need to remember about this is that the circulatory system where your blood is a continuous circuit, right, as you can see here, right, and returns. That's why it's, this one that goes to your lungs is pulmonary circulation, and this one right here is systemic circulation, because it's like a circle, right? It goes out and then goes back in. However, the lymphatic vessels, as you can see here in green, they just start at the level of the capillaries, blood capillaries I should say, and the lymphatic capillaries are going to reabsorb the fluid from here, and then they just go in one direction towards the subclavian vein. In the middle, no, I shouldn't have said in the middle, but in the passage of these lymphatic vessels, you're going to find a lot of lymph nodes. These ones are lymph nodes, okay, and they are located all over the pathway of the lymphatic vessels. I'm mentioning this because this is something else that we're going to see later on. So if we scroll down, we already talked about the different types of lymphatic vessels that we have. They're going to collect the fluid. Eventually, all these fluids are going to end up in the lymphatic trunks. Okay, and the lymphatic trunks are going to eventually end in the collecting ducts. Okay, there are two main ones. The last two, basically, one that is going to dump the fluid into the right subclavian vein, and the one on the left that is going to dump the fluid into the left subclavian vein. If we keep scrolling down, you can see that right here you have the one for the right. Okay, the one for the right here, right lymphatic duct. Okay, and if we move this a little bit to the right here and a little lower, we can see right here that this is the right lymphatic duct. Then technically this one should be the left lymphatic duct right here. This one, left lymphatic duct, because it's going to end in here. However, this is not left lymphatic duct. This is going to be called the thoracic duct. So let's take a look at this with a little bit more detail, and you're going to be able to see right here that this one for the right side reabsorbs only the fluid from this area right here, basically from the middle upper right side. And the thoracic duct, the one for the left side, reabsorbs basically the rest of your body. So technically you may think that the right lymphatic duct will reabsorb everything from the right side, and the thoracic duct, which is for the left side, will reabsorb everything on the left side, but that does not happen. So basically, instead of being divided in two, as you can see in this figure, here in purple is showing you what the right lymphatic duct is going to reabsorb of what areas, and in here you can see all the other areas that are going to be reabsorbed by the thoracic duct. So the fluid reabsorption is not divided 50-50 in your body, but rather 3/4 to 1/4.